Good morning, everyone. My name is Mary Jane Apolonio, and I want to thank you for joining me in this evidence-based practice presentation. Healthcare systems are continually striving to deliver the safest, highest quality of care. By adopting evidence-based practice, we determine appropriate solutions for best outcomes. Our PICO question: how can a close observation unit improve hospital throughput process in comparison to the medical surgical units, affect hospital length of stay within 6 months? The management of patient throughput is critical in healthcare organizations. This PICO question will hopefully answer the continued expectations of the Centers for Medicare and Medicaid regulations and compliances. At Shady Grove Medical Center, clinical teams continue to work on performance improvement projects. Utilizing a close observation unit will impact the success of a grounded throughput process. This is critical to meet the demands of patient satisfaction and organizational profitability. This presenter has partnered with her organization to work on this project. Shady Grove Medical Center is a faith-based organization that aligns system processes in achieving its mission, vision, and values. This project will illustrate how Shady Grove Medical Center continually seeks to optimize healthcare performances by grounding effective throughput process. With its 6 pillars, the people, staff, and all stakeholders will be engaged to coordinate care and processes. Our quality and safety pillar, delivering timely care, is a quality and safe care that will impact patient experience, and it will be a positive experience. Happy patients will give positive surveys. Positive surveys will give great reimbursements. Hopefully, with the throughput process being grounded, the financial health with our length of stay will then impact this pillar. A decrease of length of stay will then improve our growth. Growth of having more volume, and hopefully with our population management, we will decrease readmission rate and conversion rate. We will continue to use our values of respect, integrity, service, excellence, and stewardship in deploying this throughput process. Here's our work plan. Our work plan is to follow the DMAIC process. This DMAIC process is a very important process where the lean management model is one of the commonly used models in industrial areas. The use of define, measure, analyze, implement, and control phases are aiming to improve efficiency through this work plan. The 5-step innovation decision process is given a due date, as you can see here. The defect project toolkit includes our matrix, project charter, and corporate goal alignment, along with the cycle time. These phases are so important for an organized, systematic follow-up. On our measurement phase, we will have our measuring plan, and we will look at our line graph. We will then analyze through a single case bore and look into a Pareto analysis, then drill down the 5 whys, the root cause analysis, where we will look at our value added and non-value added variables and eliminate all ways that we can identify. We will improve through our countermeasure matrix and looking at our implementation plan. Hence, at the end, we will be able to look at our control phase, monitoring the most significant variables that is effective and will continue to improve the process. Overall, the goal of this DMAIC process is to determine which set process variable has the highest effect and therefore be sustained, evaluated again, and improved. Eliminating all the waste will increase productivity on a more grounded throughput process. So what did we find out? We find out after we look at our project description that our observation nurses are challenged waiting for the ED nurse to give us report so that we can receive the patient from the ER. We look at the customer stakeholder and multiply the impact of this to a performance gap, 1 being the lowest and 5 being the highest. Looking at the nurse being challenged waiting for an ED nurse to give report, the impact is extreme and the performance gap is also extreme. We multiplied 5 times 5 equals 25, and supporting the strategic priority as a yes multiplies to 1.5. That gave us a 37.5 overall rating. So we selected this as our bottleneck. In our project charter, we identified our business case, wherein truly to improve the time interval from the bed assigned to patient arrival on the observation unit. It is a problem that there is a delay in getting patients to the observation unit, and truly this is a barrier to starting an excellent care, longer length of stay, and impeding patient experience. We hope that we improve this throughput time interval as measured by the time the bed is assigned to the time the patient arrives to the 2C or observation unit. We also look at our objectives, our scope, our team, and our schedule. Then we'll look at our pillar excellence alignment. As I showed you earlier, with the 6 pillars of excellence for Shady Grove Medical Center, we will highly impact patient experience, finance, and quality and safe care. We will smoothly transition by observing our values of service. Our measurement plan is to be able to identify our measure of success. Our measure of success being bed assigned to the EDD part with the goal of 45 minutes and a world-class goal of 30 minutes. We will look at a desired trend, a downward trend, looking at our baseline of 63 minutes, which means that we will have our numerator as the sum of the time between bed assigned to the EDD part for all patients in the sample, and the number of patients in the sample being our denominator. We will report this monthly in an average time of minutes by looking at our data on our Cerner application. And here's our gap. From January, we found out that our gap is at 63. We are at 63 minutes throughput time, and we gradually increased to 72 minutes on March. Now we've identified our baseline, so we can truly be realistic on our target goal of 45 minutes. Here's our single case board as we collected our data. The most occurrences of such variable is the emergency department nurse not being available to get report. This is a bottleneck for us. It occurred 13 times, and we don't have control for this because the ED is busy and they get emergency cases. Waiting for results and the nurse in the observation unit being busy, yes, we have control. So we will look at our Pareto analysis, and again, it identifies that our ED nurse is not available to give us a report. So, getting into the root cause, problem number 1, EDRN not available for report. Problem number 2, 2C nurse is too busy. Problem number 3 is waiting for results. Both problem 2 and 3, we have control. Problem 1, we don't have control. So how did we drill this? Looking at the why and the why and the why is this happening as a root cause analysis. We then found out that truly this is a standard failure and not a people failure. To work on this, we mapped out our process. Mapping out our process of looking at every step as a staff nurse will be able to safely and timely bring a patient to the observation unit. And bingo, we were able to identify the value added and the non-value added variables. And we looked at our 7 ways identifying everything is on the waiting time. So we were able to eliminate all these ways. So what we did, our 2C staff went to pick patients from the ED. Looking at this graph is very important. We identified that when we go pick the patients in the ED, this will be effective, which is scored 5. The feasibility of doing this is scored extremely high. We multiplied 5 times 5 equals 25, and looking at the innovative evidence-based practice, this is a yes And yes, we can multiply 25 with 1.5. That gives us an overall score of 37.5. So this is our true bottleneck, and we were able to continually go pick up patients in the ED. We started it on April. On April, we went back and looked at it again. We identified that it's good to continue to get observation cases from the ED by the 2C staff nurse. It gives good patient experience, staff satisfaction, patient safety, timely bedside shift report. This is a result. From 63 minutes baseline, we went down to 22 minutes, almost triple. And we look at our length of stay. It came down from 23 hours to 21 hours. Compared to our med-surg and surgical units, their bed assigned to ED departure continued to be at 59 minutes. They are still on the 50 plus minutes. Looking at their length of stay, they are still in the mid 47 hours. Truly, a grounded throughput process in a close observation unit will impact the financial sustainability of the organization. Here's our impact to patient experience, our financial impact, and staff are engaged. Happy employees, happy patients. Teamwork truly is the key in overcoming obstacles to meet and exceed world-class throughput times. Clear communication is imperative and crucial to coordinate a timely transfer. Throughput time will always be measured from the time the bed is assigned to the time the ED patient departs. This concludes our presentation. Let me know if you have any questions at this time. Thank you for being with me on this presentation. Have a wonderful day.